Right, a warm welcome from Geneva, Switzerland. We welcome you to the Teach to Reach family. We've got 2 minutes and 15 seconds. This is a session that many of us and those involved in immunization have been waiting for most of the day at Teach to Reach. So let's go have a quick look at the schedule here. So most of the participants are in what is called Ring Central. That's the conference platform we're using. And you should be by now on the stage in order to be watching this live stream. Let us know, send us a comment so we know that you're actually there. We're starting in a very short time. You can see on the conference platform, many of you are still networking, I believe. Now, I think yes, and we're about to start this session. As you can see here, Humanly Possible is the hashtag. EPI, the expanded program on immunization of 50, charting the path to 2030 through leadership, integration, and movement building. We're now 1 minute and 20 seconds away. I'm going to just ask Zunera if you could turn on your... Actually, I think I don't even need to do that. All right, I think we should be all set. We're 1 minute away from getting started. Let's shift gears a little bit. All right, 45 seconds. Welcome to Teach to Reach 10. For those of you who are just joining now for this special session focused on immunization and in particular 50 years of EPI. All right, and 30 seconds. I see that some of you are having the same technical difficulties that... All right, Lillian, I think you need to register in order to see those icons for networking or for the workshop. And Susan Adinas just says, good afternoon, everyone. Here we go. All right, welcome, Lillian, and others joining the room. We're now live. Here we go. Warm welcome to you from Geneva, Switzerland. I'm Rida Sadki from the Geneva Learning Foundation. I'm here with Charlotte Mbou and Maria Manzan. Charlotte is in Ebelova, Cameroon. Maria is in Corrientes, Argentina. Warm welcome to both of you. How are you feeling about this session? Both of you have worked for quite a while in immunization. What's your sentiment before we dive in? Let's start with Charlotte.
Thank you very much, Rida. So it's kind of like just recognizing the impact that immunization has had when it comes to health in the world, the number of lives saved, and also knowing that most of those who are in this room have actively contributed to that happening, and it's like an honor to be able to listen to them share their experiences today.
All right. And Maria, now you ran for several years a primary healthcare clinic in Corrientes, Argentina. Here you are connecting health professionals from all over the world for the first time, a Teach to Reach team member for the 11th time at Teach to Reach. What are you feeling right now?
Hi, Rita. Thank you so much. Well, I think that excited is an understatement. This is very moving, as Charlotte was saying, to be honored to be among all these professionals that are actually in the front line. They're bringing immunizations to every child everywhere, and I'm very happy. I'm looking forward to hearing from Sunera and from Kate and from all your experiences. So looking forward for a great session starting now.
All right, wonderful. And Kate O'Brien was our guest for the Lightning Chat. She's the director at the World Health Organization of Immunization, the Department of Immunization, Vaccines and Biologicals, and we spoke with her last week. There should be, we'll ask them to identify themselves, colleagues of Kate's joining today. This is Humanly Possible. That's the hashtag that was selected for the 50th anniversary of EPI. And the latest estimates are that this expanded program on immunization, started now 50 years ago, is responsible, as directly contributed to saving 154 million lives. Now, before we kick off, a reminder, at the Geneva Learning Foundation and through Teach to Reach, we are organizing this session under the banner of the Movement for Immunization Agenda 2030. On the 7th of March 2022, we launched a call to immunization staff all over the world to join this movement. And within 2 weeks, we had 6,185 health staff respond. We're now over, the network now reaches over 60,000 people. And you can learn more about this movement, notably by reading some of the case studies of that we've developed together with IA 2030 leaders, including Maria, who's here helping us out with Teach to Reach today. A lot of the focus is on telling your own stories, and if you haven't seen these collections of photos taken by immunization staff from all over the world, under the banner of the Movement for Immunization Agenda 2030, I encourage you to do so. Last but not least, during the opening ceremony this morning, we also shared the Women Inspiring Women. This is a collection of 171 women from immunization and other areas of health who write to their daughters and other young women who aspire to a career in health or humanitarian work. That is also very much worth looking at, and we encourage you to download this collection from the Geneva Learning Foundation's website. Let me just show you what that looks like. It's learning.foundation/women, and you can just put in your name, your email to get access to this collection. Now, we're going to dive right in with the first question. We're celebrating 50 years of EPI, so logical question. This is a long one, and it has got lots of questions within questions. We would love to hear, but basically we'd love to hear your immunization story. And the questions we ask are, how long have you been doing this important job? Now, if you're listening in on the conference platform, we encourage you to share your story using the chat function. So you can see that here. Welcome to Dauri Manyanga, Penina Okech, Tesfei Sheke, who still has problems with the network that was before this session started. So please do share your response to that question. The same if you're on YouTube, LinkedIn, Facebook, Twitter, X, wherever else you may be. And then I'm going to turn to Charlotte to guide us to see from our guests of honor who are in the Zoom room with us, who we shall hear from. Okay, and I see you're way ahead of me, Charlotte. Isha Goyal has a microphone unmuted. Isha Goyal, a warm welcome to you. Please do introduce yourself, and then we'd love to hear your immunization story.
Hello, everybody. I'm Dr. Isha Goyal. I'm working as Surveillance Medical Officer for World Health Organization. I'm working at district level. And as part of my job, I am regularly working for the immunization of children. The most important challenge which I feel in my working area is the acceptance of the vaccine on the supply side, on the demand side, and on the supply side, the main challenge is the motivation of the health workers. I'm trying my best to motivate all the health workers so that they can further motivate the families or the beneficiaries to get vaccinated. But still, I'm struggling and I'm not finding any way out to motivate the health workers. So I'm here in this session. Maybe I get some solution from here, and I hope I will get. And this is the beauty of this platform, that we get to learn from each other and are able to apply these strategies in our own area for the benefit of the beneficiaries.
Thank you very much indeed, Isha Goyal. So we're celebrating the 50th anniversary of the expanded program on immunization today under this hashtag humanly possible. Can you tell us what this means for you personally? You're a health professional. You work in immunization and primary healthcare, I believe. When you see this picture, this slogan, this powerful idea that vaccines work, and the latest estimates, 154 million lives saved, what do you feel?
Yeah, it's a really beautiful feeling being in a health workforce, and I'm posted in my hometown also. So that is a plus point for me. I'm delivering something to my birthplace and I'm giving these services here, and I'm able to save the life of even one child. And it means a lot to me. And this thing also I use to motivate the health workers, that directly we cannot observe how we have saved the lives, we can see only through the indicators, like we can see the infant mortality rate or neonatal mortality rate. But still, if we think over, then we can find out that how many diseases we have prevented and we have saved how many lives. So this is really a very beautiful feeling. And I have seen the magic of vaccines, because last year there are a lot of measles cases in my area, after which we had outbreak response immunization. Lot of children were vaccinated, and in fact the unvaccinated children were covered. And it and we were able to control the outbreak in most of the areas, and that is because of the vaccine only. So we can, in the real time, we can see the effectiveness of the vaccines, that how a outbreak is controlled by giving the vaccines. So it's very important. The vaccination is very important for the benefit of a child and for the longevity of the child.
Thank you very much indeed. Isha Goyal, you're our first speaker in this 50th anniversary celebration of the EPI, the expanded program on immunization program. Thank you. We have this next question, which I'd like to invite you to consider as well for our next speaker. Can you think of a situation where you had to overcome a major challenge to get a child vaccinated? What was that challenge? What did you do? Who or what helped you? How did things turn out? That will be perhaps some of the questions that we'll ask our next speaker. With us in our studio, it is Zunera Gilani. I'm going to say it's a hard G. Okay, and she's nodding positively. A warm welcome to you. You are a senior technical officer at USAID responsible for immunization. We've invited you as our guide on the side, building on some great collaboration around Teach to Reach with the USAID immunization team. You're listening as our guide on the side, and we'll be turning to you in a few minutes to share, to hear your feedback, your insights, and maybe ask you some of these questions, ask some of these questions to you as well. So Charlotte, I assume there's already someone ready to go and ready to share their experience.
But I'm inviting Melissa Teferi, who is unmuted, to go ahead, and I hope connectivity will hold for you, Melissa.
Thank you, Charlotte. Can you hear me, please?
Yes, please.
Thank you for having you in preparing this interesting session. I'm really happy to be part of this event. And my name is Melissa from Ethiopia. I'm a public health expert, currently engaged in research activity at the national level. I have actually a long experience that I was engaged in immunization from the district to the national level. Now I'm just engaged in national level as a researcher. During my immunization activity, there are actually some challenges that I faced and tried to solve working with my colleagues. So the main challenge was actually the planning system, and the decision-making activities were not based on the data that's already, or we were not using evidence-based decision-making so that to address challenges that's faced in the implementation session. So this platform may be very important to learn for frontline healthcare professionals how to plan and how to mitigate challenges that's faced during the implementation. So it is a great experience having it. So I'm happy to be part of it, and I still passionate in working immunization program, because in Ethiopia there are huge backlogs, especially zero dose children. So addressing this gap may need the committed political system and engagement of collaborators like WHO, Gavi, and national government system, And also, the community engagement is a very important or key activity that should be motivated, so that we have to work in the awareness creation in the community. And as you know, the topography in Ethiopia is somewhat challenging for immunization programs. So accessibility also one thing that should be addressed. And it's really important to have a good cold chain system that the healthcare professionals can go to the community and try to address as well. So this is my points to be shared. Thank you.
Thank you, Melisif Teferi. That sounds like an attempt you tried in as few sentences as possible to round up many different challenges. Let me just remind Teach to Reach participants and contributors and guests of honor who are with us in our Zoom studio. Think about a very specific situation, a story, rather than try to cover everything. Tell us about things that you actually did and carried out, as opposed to more general or generic considerations. So, for example, this question is, can you describe a situation where you had to overcome a major challenge to get one child vaccinated? We're interested in what was the challenge, what did you do, who or what helped you, how did things turn out? Now, as we do have some very technical questions for that many of you answered in the Teach to Reach questions. For example, where you work, are pharmacists and drug shops involved in vaccinations? And the running thread in these technical questions is the integration of immunization with other health interventions. So if you'd like to share on your most memorable example, successfully vaccinating a child during a visit for another health issue, that is one of the many Teach to Reach questions where we asked you. Some of them are quite similar to one another. Back to you, Charlotte, to introduce or open the mic for the next speaker.
So we have Neka, whose mic is already open, Reda.
Thank
So
you
Neka,
very
over
much. Thank you, Charlotte. I'm Dr. Onwu, retired from National Primary Healthcare Development Agency in Nigeria. And I would like to look back with Teach to Reach as we look back on 50 years of immunization, and happy to hear that we're looking at a whole family approach in terms of immunization. So my experience would be about 20-something years ago, my experience in Port Harcourt, and it was where I had to face an issue of a communal clash, having to vaccinate children who have been internally displaced from a community due to communal clash. That was in an LGA called Obakiri in Rivers State. I was a local, what you call central facilitator at that time. And I was posted to this local government working with the state and the local government workers. However, we had like 5 districts, and then we used to do sweep, and that's for PEI, when we were talking about PEI. And 2 of those communities had issue. Was the one that had internally displaced persons, and the other one was hard to reach. So I had to break it down. How do I vaccinate in a place where everybody is internally displaced and the communities had dispersed due to some clash they had? People had been killed and nobody was in the community. So the first thing I had to do was to reach out to the LGA and get the security, the what you call the SS, to accompany me to that particular district. And when we got there, we found that all the children had left the villages, and one of the villages had been taken over by bandits who were mining, illegal mine, that is bunkering, as it were. And so we needed to get them trained. In those days, you stay in the LGA for about 3 weeks. So going with them, we were able to meet one of the communities, one of the villages that had their children had left. Only the elderly ones were left there, and made them promise to get their children vaccinated wherever they are, to take us there. And we needed to train somebody because nobody wanted to go. So we had to train somebody from that particular village to be a vaccinator. That took us then to the next one where we had the bandits. We didn't know how difficult that would be, but I went with the SS, and alongside we now met up with the security force, and they accompanied me. When we got to that particular place, we saw young men coming out. They surrounded us, And then we insisted that we sit down and have a meeting. And as part of that, they asked me, okay, you're here for vaccination. Where are you from? I had to say where I was from. They said, did I have an ID? The person I came with. And they brought out what you call a hard drink and said I should swear allegiance, that I will not, that I'm there for peace and not for war. And that meant drinking some alcohol. I refused. I gave them a lot of statements. Okay, I should dip my finger. But somehow I managed to escape that. I dipped the wrong finger and licked the wrong one. Anyway, they did agree to get their children vaccinated, those who were in that particular community. But they had to give us 2 people as well to be trained. So I was able to train 2 people for that particular village and 2 from the other village. At the startup, they went through the training. We gave them the data tools. They went in and vaccinated. We were able to get the data. But also I had to give a promise. And the promise was that I was going to bring them drugs, anti-malarial drugs, because the children were dying. Got to the LGA, all the drugs had expired. I had to use my own resources to get the drugs and make sure, because I made a promise and I had to keep that promise. So that was an experience. I keep remembering it till this day. And I'm happy to see that that particular communal clash has now ended 11 years after. So sometime they've now resolved it, but we were able to vaccinate the children. They all came for the 2 villages and we got them in a safe place and got them vaccinated. That was my experience and I felt I wanted to share that with you. Over.
We are honored, Neka Onwu. Can you tell us, there's one number you did not give us, and it is not a vaccination indicator. It is how many years did you work in immunization in Nigeria before being, I believe, happily retired now?
I've been in immunization for, I think, since 19. I'm a public health physician, a consultant public health physician, and I was with National Program on Immunization when I did the work. So I was in immunization since at the center of, I said 2000, and I joined MPI in 2003, and I retired in 2022. I was the head of non-polio SIA in MPA-CDA from 2012 to 2017, and went on to be directors, community health services, and director of primary healthcare systems. So I went across, and I'm happy we're looking at broadly on immunization as a whole family, because I believe that it should, look at the whole gamut, both nutrition and also what do we do for the woman who comes to the facilities in terms of TT vaccination. And as we look at the adolescent, what do we do about HPV? So I'm happy 50 years of immunization will help us work towards that, integration, full integration across board for immunization and other services. Over.
Thank you very much indeed, Neka Onwu. That's quite a testimonial. We've heard just 3 voices so far. And I heard questions and experiences around motivation. I heard community. I also heard what we would call today fragile context and integration with communities asking for not just vaccination, but other services, and then logistics and access. Zunera Gilani, we'd love to hear from your perspective. What did you hear from these first 3 stories? And as our guide on the side for today's session, what comment or insight or feedback would you like to share?
Thank you so much. And I want to start by asking if everyone can hear me okay.
Loud and clear.
Okay, wonderful. So just want to start by saying it is really an honor to be here and to be a part of this community. I feel already so motivated and inspired by some of the stories that have already been shared. And I'm going to work my way backwards and start with Dr. Neka and then end with Dr. Isha and just share some thoughts and reflections. So starting with Dr. Neka, I just want to say that I am so impressed by your dedication to children, your creativity in providing solutions, and also staying true to your ideals while doing your duties as a public health worker. You brought up a lot of important points that I think we can emphasize for everybody that's in this meeting right now. I think first of all, there's this issue of the children that you are trying to reach in this IDP community. they wouldn't have been reached by the traditional microplans that were developed for the area. And so you recognize that. And it seems like the way that you describe things, you really provided tailored strategies. And that's really needed in this context, in this fragile context. So you mentioned providing other services. That's really a best practice that I think is being encouraged now. Some of the additional services that might be useful to provide in these types of settings are, for example, wash services for livestock, nutrition services. You mentioned providing other drugs. Those are all best practices. You also mentioned having to work in a security constrained environment, so making sure that those security protocols are in place. I was really impressed by how you reacted to the situation and really used what I consider another really important component of your response here, which is advocacy. You mentioned to those young men that you were there for peace, not war. And it seems like you really had the proper communication skills to make sure that those children were vaccinated. I also want to mention that while security compromised situations, that's one example of a fragile context. There's also other examples of fragile contexts which might use some of the same strategies. And as we're in this situation where climate change is, of course, more of an important issue, we need to consider some of those strategies as well. So just thank you again so much for your efforts, Dr. Neka. Really am impressed and inspired by your story, and I think others can learn by the actions that you took. And now going on to Dr., and I don't know if I'm saying this correct, Dr. Malise from Ethiopia. I really liked the way that you described how you had your own journey from working at the district to the national level, and now that you're a researcher. And you mentioned how you had to really make sure that you operationalized the activities that you wanted to do. You described some challenges that you faced during implementation. And to me, what this really comes back to is having a good microplan. So how you identify your target population, how you'll reach them, what strategies will be best to reach those populations. Sometimes you might need to work in facilities, but you mentioned that there's a number of hard to reach areas in your communities that you're working in. So in those contexts, maybe you need outreach if the topography is difficult. How do you encourage those people in these hard to reach situations to get vaccinated? Maybe they can't access facilities, and maybe you need to focus more on community health workers in these contexts. So what I encourage everyone listening to do is really you have a microplan, but you're still going to have challenges in implementing that microplan. So validating your microplan is really important for everybody working in service delivery. And then finally on to Dr. Isha. You really mentioned two issues, I think two big issues. You talked about vaccine acceptance and demand, and then you also talked about on the supply side challenges with healthcare workers. So on the vaccine acceptance demand side, I'd say really the focus, and it seems like you did focus on this, but it's something for everyone on this call to consider, is making the service experience better for the providers, but also making the service experience better for the caretakers that are coming in for those immunization services. So we really have to think about the quality of care. Is the facility where the children are coming in, is it a good environment? Are they being treated respectfully? Are there questions being answered? What is that whole service experience, and how do we make that whole service experience better so that when the demand is there, that they actually will want to come in for the vaccinations? And additionally, when we talk about acceptance of vaccine, we really do have to think about vaccine safety as well. So part of having a strong system is you really need to have a transparent system. And in that context, I think that you need to have the communication to let the caretakers know that there might be, for example, adverse effects following immunization, and that some of these can be expected, but some of them may not. And if that's the case, then there are situations where the child may need to come back. I also wanted to talk about, when you talk about the motivation of the healthcare workers, and I really do think that we have to recognize, especially when we think about EPI at 50, that there are a lot of demands on these healthcare workers. Maybe at the start of EPI, they were providing vaccinations for a few antigens. Now there are so many more antigens that they have to provide. So they need to know about these vaccinations. They need to know about the side effects. They need to dispose of these vaccines properly. So we're really expecting a lot more of these healthcare workers. And so efforts at the global, the national, and the district level and at all the local levels to professionalize the health workforce, I think that's a really an important consideration. We need to make sure that healthcare workers, that they're paid, that they're respected, also that they work in a safe environment, that they have opportunities for advancement as well. And I really appreciated, Dr. Isha, you talked about what motivated you to get into immunizations. You mentioned that you really saw the magic of vaccines in the context of this measles outbreak. And that this just really connects me with you in many ways, because I am also motivated in a similar way. It's the magic of vaccines that has led me to this field and has kept me in this field for a long time as well. So just want to thank you all for sharing your stories, and I'm going to pass it back, I think, to Reda now. Thank you.
Thank you very much indeed. Zunera Gilani, multiple apologies, is from USAID, and of course is a technical advisor from the global level. From 3 stories, we got a condensed set of guidance and feedback for those of you who are here. And yes, I do want to bring attention to Faiza Rabbani's message. Charlotte, can you tell us what Faiza shared? I'm sharing it on screen, and we of course extend our best wishes to her colleague for condolences. We perhaps at the next Teach to Reach 11, we need to organize a session around self-care and health workers and the risks that are faced by health workers and how we can best respond and support each other. Charlotte?
Yes, Reda, and we wish a quick recovery to your colleague Faiza, who accompanied you to a medical camp and contracted chickenpox. So we do wish that she recovers fully and speedily. And we also use this opportunity to also extend our thoughts and our prayers to all other health workers that are facing similar situations right now.
And yeah, Faiza ends her message saying we must safeguard ourselves during service delivery. That is indeed an important theme that we'd like to perhaps does belong in a future Teach to Reach. Let us know if that is your thought as well. Let's dive back into the stories and experiences. Of course, we have very specific questions around integration of immunization with other health interventions. For example, where you work are pharmacists and drug shops involved in vaccination. Your most memorable successfully vaccinating a child during a visit for another health issue is another question like that. Describe a situation where seeing a child for another reason opened the door to discuss and give vaccines. Those are some of the questions. But above all, because we are celebrating 50 years of the expanded program on immunization, we would love to hear your immunization story. And if you are with us in our Zoom studio, you've been invited as one of our guests of honor. So please do not hesitate to raise your hand. Apologies in advance, as I see already many hands raised, and we probably won't be able to hear to everyone. Go ahead, Charlotte. Back to you.
Yes, Reda, we have Lilian Mutua, whose mic is already open. So over to you, Lilian.
Thank you. Good day, everybody. I just want to share my experience about vaccination. Being in the capital city of Nairobi, we've had challenges during the immunization campaigns, and we know that even during the immunization campaigns, we do find the 0 doses, and we also find defaulters as we immunize. But my greatest challenge has been with some part of the community that has a lot of illegal migrants or illegal refugees, and they also host a big population of the diaspora travelers and migrants who have come to stay with their families. So during these campaigns, the ones who are here illegally do not want to, the families hosting the ones who are in their households illegally do not want to open their houses for the vaccinators because they think that we are going to discover that they are holding people in their households illegally because they do not have any certification for being in country. For the ones who have traveled from other countries, especially from countries like Europe, Canada, and the other parts of the diaspora, they also do feel like they do not want the vaccinations given in country, even during the campaigns, because they feel that from the country that the child has originated from, they feel that that child is protected and their vaccine is superior. So we've had a challenge always trying to explain to them, for example, in our last polio campaign, that we were giving the vaccine, which is only supposed to be for polio 2, because we had already had an outbreak with in Somalia, and 15 cases reported in country. So when it becomes difficult for us to negotiate with these people, it has been over some time of period, but during the last campaign, I brought in into my mobilization team religious leaders who are from that community, who are very well known. We also brought in the administrative leaders from that area. And we also worked with the gatekeepers who are known and who have stayed in that community for long. And I was able to also identify one mobilizer who is a lady who could speak their dialect. This community is majorly composed of Somali community. So I was able to get a lady who could speak 6 dialects of Somali, and she is a community health promoter, and she could be able to translate. So with all these different teams on board, we were able to negotiate house by house, and we were able even to go as far as where we got a caregiver telling us that the child was coming from out of this continent and their parents were living elsewhere. We were able to ask them to give them a call, and we could have a conversation with them on call, and would explain. And most of them were able to come on board. They were able to appreciate, and we were able to vaccinate their children. So for this community, normally when we are doing our immunization campaigns, like the one we were doing for polio, this one sub-county has always not done up to 100% of the coverage. But for the last 3 rounds of campaign, we were able to surpass the 100% mark, because it's also one of the sub-county that hosts a lot of commercial business. And we were also able to tap into the travelers who are traveling out of the county and out of the to go to other places out of Nairobi, and also those people who had come to the business community with their children. We were able to get them on board. So for me, it becomes a challenge when you do not really sit down, analyze your community, understand what the barriers are, and just maybe want to work as health. So for me, I feel for me it is a plus, because for mobilization, for demand creation, for us to overcome that barrier, we were able to bring on board the religious leaders, the administrative leaders, the gatekeepers, and we were able to work as a team. And we have discussed and found that this is the same way we'll be doing all our health activities, with those people leading in the front and us only to give in the services. For the pharmacies do not offer vaccination in our country, but we have people who have their own owned small clinics where they get these vaccinations done. And most of the time you'll find the young parents want to go there because they don't go and line up for long, and they are paying. So you find they don't queue for a long time. So we have also brought the owners of the private clinics on board, for especially when we are doing the CMEs. We are also doing support supervision to see that they know how to fill in their reports and hand them over before the time for reporting is ended, because we found that most of them were not giving in their data They were waiting until when they have consumed their vaccines. That is when they are coming with the reports. And maybe for the reporting time, it has been already elapsed. So you find that the coverage will not be looked at the maximum because they have brought in their reports late. So we are working both with the communities, we are working with private, faith-based, and private hospital and facilities. And for demand creation, we are bringing other people on board. This year, I'm looking into tapping the corporates so that we can be able also to reach the other affluent society. Thank you, and over to you.
Thank you very much indeed. We're deep diving into experiences shared by immunization staff from all over the world. I did note, before we go to our next speaker, Charlotte and Maria, I did want to highlight this. This is on the theme of self-care, which we had not thought about, but Faiza Rabbani's message sharing concern for her colleague spurred this, and this feels like something we should put on the agenda for Teach to Reach. One of the great challenges, says Manuel Sambo, for health professionals is psychological assistance at peak times, since the same health problems that the population has are also faced by the professionals' families, and in cases where it is impossible to treat their families due to local incapacity factors, the professional is practically handcuffed and unable to support their own. This was very noticeable when COVID-19 struck. Just a thought, and something we'll probably discuss with the Teach to Reach community to see if this is something that you would like to come back to. Back to you, Charlotte and Maria, for our next speaker.
So right now we already have Alfred Kipkiri Langat, whose microphone is open. Alfred, over to you, and please do start by introducing yourself. If Alfred is not able to speak, we'll invite Usman Mohammed Tuku. Usman, over to you.
Okay, thank you so much, Charlotte and Reda, for giving me this kind of opportunity to showcase my experience based on immunization. First of all, my name is Usman Mohammed Tuku from Nigeria, Kano State. I'm a public health practitioner working with 10 years working experience with many organizations in immunization programs. Actually, there is one key non-habitual, non-compliance. One time I intervened to resolve it in one of the particular community we are working. At that time, I'm a consultant with WHO in Kano State. So my strategies, any new community, if I went there, first of all, I have to go and introduce myself to the community structures, especially the ward head and the imams. So during that intervention in that community, actually, at that instances, there's a reshuffling of the team members who are delivering immunization in house to house. So unfortunately, one particular house were identified with non-compliance issue. The mother of the two child said that her husband said that she should not allow anybody to immunize his children. If she allow, that is the end of her marriage. That is the end of her staying in that home. And the husband normally used to travel to some state. Maybe he can take 1 week, 2 weeks before he come back. So actually, by the time the issue were brought to me, then I asked them to ask the woman why. She said that is the reason, the only reason her husband leave it to her. And she has no choice because she prefer her marriage than the immunization. Okay, so I identified the house and went particularly to meet the ward head of that particular community and inform him. He said he know the house. Then he come and join us to go to the house and talk to the woman. She said, this is a message left by her husband. Okay, then the ward head asks her to give the number of her husband, to give him the number of her husband. She give him. Then we called the husband, and he introduced himself as the ward head of that particular community. This is the situation. We are in front of your house. He said, yes, actually, it's true what she's saying. The reason why he don't want such kind of things is not just now. There are so many things that he needs, so many intervention he needs, like malaria intervention, fever, and other things. But he don't used to get such kind of intervention. Why always follow? And the second reason is religious belief.
Did we just lose Usman, Charlotte?
He's still unmuted, right? But I can't hear him.
Yeah, same
so
here.
Probably he's having technical issues.
And we make a team. We make a team. In the next day, the ward head, the mayor, and the religious leader went and meet the man, and we explained everything to him. He is convinced that even the religious leader talked to him, preached to him. The issue of health, even in the religion, is very, very key, especially to the children. If you're not allowing the children to get vaccinated, you are denying so many things for them. And unfortunately, at that instance, his neighbor house, they used to accept the vaccination. As we are discussing, the neighbor come out with his children, 3 of them. He met us discussing such kind of issue. He said, that is the issue I have been explaining to him. Look at the nature of my children. Look at the nature of his children. Physically, they are not the same thing. I explained to him several times, but he refused to agree with me. So that is a problem. So we really talked to him based on health, based on religion, and based on traditional belief. We convinced him this is not good. You are denying so many things to these children. And he agreed and accept such kind of vaccine. So that's solution we got. I really, really happy with it. And anytime if I remember such kind of things, I'm proud of delivering such kind of services to salvage the life of children, which is very, very key. I actually appreciate such kind of things. Thank you so much. Over to you.
Thank you very much indeed. I'm sorry, Usman Mohammed Tukur. I think we may have missed a piece of the story due to connectivity issues, but that is, let's say, part of life. Back to you, Charlotte. Looking forward to the next story.
Yes, Radam. It's as if we'll not be able to hear Alfred, though his mic is muted.
No.
So I'm inviting Mohammed. Alfred, are you able to speak? Okay, so I'm inviting Mohammed Quresh Jimale. Mohammed, go ahead and unmute yourself. Your hand is raised.
Thank you. I think you're hearing me well.
Yes.
Thank you, first of all, Reda and the Charlotte, for organizing such a platform. Really, I've joined this platform 2020. Up to now, I'm just following. My name is Mohammed Quresh Jimale. I'm from Ethiopia, particularly the Somali region, where they call Horn of Africa in Madeira Triangle. And what I've seen, and I'm working for non-organization that's called PSF Swiss as a project manager of 3 provinces. But being in this scenario, I just followed the platform because I'm just getting a lot of information, a lot of sharing ideas, and a lot of things that I cannot really mention because I really first appreciating. Coming back to the agenda about the immunization.
Yes, Mohammed Quresh Jamali, we're going to need you to, as we've got 14 minutes left in the session. What is the story that, what is the immunization story you'd like to share? If you could be concise and get to the point, that will be appreciated by everyone in this celebration. I see now your microphone doesn't, seems to be, unfortunately, off. And this sometimes happens. We invite you, Mohammed, to share your story in the chat, and then we can read it or show it on screen as we keep going with the last few minutes of this session. So Charlotte, back to you. I'm sorry we lost you, Mohammed. Let's keep going. Oh, and maybe we lost Charlotte too. This has happened before.
No, I'm actually here, and I'm inviting Gifty. Gifty that left quite a lengthy experience in the chat, but she'll be ready to speak to us as well. Even though we are getting a scratchy sound from your microphone, Gifty, are you able to speak with us?
Yeah, hello.
Yes,
hello.
Gifty.
Okay. Yeah, hello, everyone. I'm Gifty Akosi Ajigbe from Ghana. I work in the Gumwa West District and a public health nurse. I've been working in the immunization field for the past 11 years. This March, I was 11 years in the immunization field. And so with my story, yes, which I just shared recently in the posts, I can remember one afternoon when we came to work. So in the morning, so our in charge then at the reproductive and child health unit asked us to go out and to trace our defaulters. And that was when we had to trace one young teenage girl. But then she was 17 years because she got pregnant when she was 14. And then so 17, she was carrying her second child or has given birth to the second child. And that has been her way of behaving. Like she doesn't come for antenatal care, not even to even come for delivery. You have to go to her house, you have to render service to her, and then when she delivers to you, have to go to her house and still vaccinate her, right from BCG, right from OPVO to the last vaccine that she's supposed to take for her child. So that day we have to just pack our things and then go and trace this girl. I was almost nearly bitten by a snake with that hot weather. I mean, with the sun scorching so hard, but like I said, with the pledge we took that we are leaving no child behind and we are leaving no one behind, we have to just adhere to that pledge. And I was glad I did, because when I went, I had to educate the woman, I had to let her understand the benefits that she will be so happy to see her baby so healthy from the time she has given birth till the time the child will be old, and then how relieved she will be seeing that this child is going to be a healthy one and also have a herd immunity in the community. And then she understood. And she allowed us to also vaccinate the child. And when we're done, we thanked her and then we left. And I was glad I did. Yes, although it was somehow not too comfortable, but then, like I said, with the pledge, I was so glad that I did, because I'm happy I'm part of the General Learning Foundation. Thank you. Over to you.
Thank you very much indeed. We have just 10 minutes left. We may be able to hear one more experience shared, but we have something very special that is going to be of great interest, in particular to the Nigerian Scholars Teach to Reach participants. We made a first initial announcement this morning. We are going to be launching a new initiative in collaboration with UNICEF and NPHCDA. But before we tell you about that, Charlotte, I suggest we go hear one more person, if there is still someone who has a hand raised and has been waiting to share. Then we'll make the announcement for the Nigeria movement for Immunization Agenda 2030, and we'll go back to Zunaira Gilani to get her final thoughts and reflections before we close. All that in the next 9 minutes. Charlotte, who shall we hear? Who shall be our last speaker for this special celebration of 50 years of the expanded program on immunization and the movement for Immunization Agenda 2030?
So, Reda, we're not able to hear Alfred Kipiri. I wanted to give him a last opportunity, but good to know that he put his experience in the chat, and I would like to earn off by reading it. He's unmuted, but he's not able to speak, surely having some technical issues with audio. So,
please go ahead.
He says, Okay, I would like to share a story on immunization. I'm Langat Kipkiri, a public health nurse working in Kericho, Kenya, as an immunization focal person. On the 19th of June 2024, while I was visiting one of the immunization clinic sites, I saw a mother with a young child who was sighted in a queue, looking worried. I went to her and asked her to follow me to a triage area where she told me that the child, 2 years old, was sick. I took the temperature and weight of the child and escorted her to a pediatrician to review. After the pediatrician had seen and prescribed the medication, I took the child and the mother to the immunization room where the child was given vaccination for third doses of pentavalent OPV, PCV10 and MR1 antigens and was given a return date of 4 weeks. I encourage that we should be screening all children who visit our facilities for whatever reason for their immunization status. All children deserve protection from vaccine-preventable diseases. Thank you for sharing that, Alfred.
Thank you very much indeed. All right, before we go back to Zanera Gilani to ask for her final thoughts before closing this session, we do have an announcement to make. So here we go. So we're very pleased to announce our support to the Nigeria Movement for Immunization Agenda 2030, and this is in partnership with UNICEF and the National Primary Healthcare Development Agency of Nigeria. Going to show exactly what this is about. There is already a page where you can find more information, and we will be opening applications very soon. So this is the Immunization Collaborative for the Children and Families of Nigeria, where we are going to be inviting you to share experience. But unlike Teach to Reach, where we basically then ask you what have you done with the experience that you shared or with what you learned. Here in the Immunization Collaborative, we're really going to shift the focus to taking action together to strengthen routine immunization. So this is in partnership with UNICEF and NPHCDA. And you may ask who this is for. Well, there's a very simple answer, which is if you are a health worker in Nigeria and you want to make sure that every family is protected from diseases that can be prevented by vaccines, this is for you. It does not matter who you are in the health system, what your job is, or where you work. What matters is that you want to make a difference for the children and families of Nigeria. If you face any of these challenges, children who have not been vaccinated, children who have missed vaccines, outbreaks of vaccine-preventable diseases, people in the community who do not trust vaccines, communities that are hard to reach, barriers that make it hard for some people to get vaccines. If you recognize yourself in any of these challenges, we especially invite you to join. So this will be holding a more formal launch, but we wanted to announce it. We announced it in the morning. I'd like to ask now, I'm going to lower all hands, and be good before we go back to Zanera to hear from at least one Nigerian Teach to Reach participant. I know there are many this morning who would like to speak to react to this. Please raise your hand if you're with us in our Zoom studio. I'm going to go check in on participants in the in the main plenary room on the conference platform. All right, and we have a message from Mekit Ketena. All right, who shall we hear from? Otherwise, we'll go to Zanera, and we realize we will be holding a special launch event specifically for this initiative. And Duka Ozor says, I'm happy I participated in the Teach to Reach conference. I've been engaged since 7 a.m. Yes, indeed. And attended all the sessions. I'm especially pleased to have made valuable contacts for networking and potential collaboration. Yes, that is exactly what we were hoping for. So, Zanera, I believe we're going back to you. Again, we have very little time left, but we'd love to hear some synthesis. What did you hear in this conversation, in this dialogue, in the few experiences that were shared? They're part of a collection, of course. We have literally hundreds of Teach to Reach participants who shared experiences, stories of immunization, but also on integration of health services. You can see the covers of both collections, and that will be shared with every Teach to Reach participant. Would love to hear your final thoughts and insights on this particular conversation.
Thank you so much. And considering the time, I will tried to really condense down my thoughts and reflections here, but I wanted to speak once again to each of the participants that provided some of their experiences. So starting with Alfred, what you presented was really a classic best practice for reducing missed opportunities for vaccination. Several of the things that you did, which I really appreciated, were that you had the pediatrician review the child's chart to make sure that they were eligible for vaccination. And really importantly, making sure, even though that the child was sick, that the child did not have any contraindications to receive the specific vaccines that the child was eligible for at that time point. So really addressing missed opportunities for vaccination, it takes a lot of planning. You needed to make sure that the healthcare worker was available in the immunization room. You needed to have the vaccines there, a way to dispose of the vaccines. You needed to have a method to record those vaccine doses. And there also needed to be policies and guidelines in place, including describing the local catch-up schedule. So there are global and regional and country-specific guidelines for reducing missed opportunities for vaccination, and I encourage everyone to review some of those. Gifty from Ghana, really what you shared was so inspiring. Some of what you did, which I think we can all learn from, is that for this specific defaulter, you went to her house, so you met her where she needed to be met, but you also were able to share communication messages that spoke directly to her as a mother. You tailored the communication messages for her, and you were successful in that. And that is something that we can all learn from. Each child that's vaccinated really is a tremendous accomplishment. And I think everyone that's in this call recognizes that. I really applaud your dedication, and we should be inspired by your efforts. And then finally, Usman Mohammed Taku from Nigeria. You brought up a number of important points with this habitual non-complier. What I think is important is two things here. So first really is gender mainstreaming. We have an example here of a father that wasn't encouraging the child to get vaccinated. And so activities to do this type of gender mainstreaming, which involves not only empowering women, but can also involve providing information and doing advocacy to fathers. For example, fathers meetings or dads clubs. These are strategies that had been used in other contexts to advocate for fathers supporting vaccination. These have worked, and I encourage others to explore these. You also worked within the structures that were in place. You met with the ward head, you called the husband, you addressed the religious concerns. You really showed persistence, creativity, and you worked in a locally tailored way that made sense in your context. Now, you brought up polio demand as well. I think that the demand for polio vaccine, this is definitely an issue, and I know that there have been efforts to address this. Part of this involves integrating polio vaccine with other services, and I think this is a way to increase demand in communities. I know we're out of time here. I did want to share a few resources in the chat, so I'm going to ask one of the organizers if it's appropriate to put those links in the chat. These are to some resources that could be useful at the global level, but also really practical resources that might be useful for those of you working more at the district and subnational level.
So yes,
but thank you so much
absolutely.
For this opportunity. I really enjoyed. Like I mentioned before, I'm just so inspired by all the stories that were shared, and I think we should all be inspired by them and continue to do the good work that we're doing. Thank you.
Wonderful. Thank you very much, Zanera. And yes, indeed, sharing resources, sharing experience is what Teach to Reach is all about. In fact, we'll be sharing the resources that you highlight with the full list of all 21,389 participants who joined Teach to Reach. So now here we go. Teach to Reach is not done. We are done with the plenaries for today, but let me take you to the schedule, and you will see there that there is a lot more happening. So first of all, we have in the sessions, we have a workshop on neglected needs of women's health. This is with eHealth Africa and EHA clinics. So with some distinguished guests, including Dr. Ifunanya Ilodibe, Dr. Zara Isamodibo, Dr. Chito Umeni Nwama, Sei Amau and Dr. Tambari Femi Olo Wole. So we're going to invite you and encourage you to join this workshop if you're interested in this issue of neglected needs of women's health. But parallel to that workshop is the networking 3-session, networking around the 50 years of EPI. Again, to network, simply go to the Speed Network, you click on Join Now, and then click on Join to really meet someone new who is also participating in Teach to Reach today. If you'd like to join the workshop, you go to the sessions, and there you go to Meet eHealth Africa and EHA Clinics.
I'm going to introduce who are the true subject matter.
And I see the workshop has already started. Once again, this has been an amazing day. The only thing keeping us alive is Charlotte and Maria, is your energy and the experiences and sharing that have happened today. We'd like to share a little bit before we go with the some of the messages, to acknowledge some of the messages you've been sending about, for those of you, especially for those of you who are here throughout the day. So thank you, Duncan Okaka. Says it's been an amazing moment, time spending here, learning and understanding what is happening. Really, it is an amazing day. Thank you, Mohammed Kurash Jamali. Yippee, this is so amazing, says Lenora Eminari. Teach to Reach, building a team together. Yes, that's it. Thank you all for the insights and hard work of the front lines each day. So inspired. Adeyemo Sunday Charles, it's been very educative, informative, enlightening sessions from the start. A lot of shocking stories, a lot of knowledge sharing and experiences gained. Thanks for the organizers and partners. Susan Adima just says, quite amazing. Lucy Pam Dangyang says, this is an amazing session. It was a day of learning and exchanging useful information for fitting in various programs. Melise, please, I need to learn a lot from you. Thank you, Emily. Christopher says, well done, Charlotte and Reda. And I would add, Maria, your efforts are much appreciated. Continue the good work. Melissa Teferi and Muhare Ronald Zion. Thanks goes to the organizers. Thanks go to you. The organization of the sessions is superb. Thank you. Seamless and fitting into each other perfectly. All right, that's what we were aiming for. We weren't sure if we would get there. Neka Onmusas, thanks a lot. We'd love to follow up with you and other retirees from NPHCDA as we get ready to launch this new initiative for Nigeria. For Alfred, we're sorry we didn't get to hear your voice, but you were certainly there. Thanks for the chance. You say to have joined the team. It was my first time, but it was very educative and insightful. Susan Adina says, thank you. And Adan also, thank you, Charlotte, Rida, Maria. All right, well, I'm going to stop reading them and we're just going to enjoy these comments as we close this plenary. But Teach to Reach is not over. I hope that you'll be able to join. Okay. Right, and thanks, Charlotte, for clicking on the button to join the session.